just got an update on a developing story this morning. A reported burglary from the Goodwill warehouse in Germantown. And this one, you're looking at a live picture right now as officers have been on the scene for over an hour this morning. Photojournalist Aaron Pryor just spoke to police. He told us they have a suspect in custody. And I'm not sure if the suspect is in the back of that squad car or not. Hard to tell from here, but what happened was at the corner of 2nd Avenue and Monroe, where this warehouse is, someone reported seeing a man running from the facility with some kind of cart. Officers found that suspect, and they were able to get the suspect into the squad car, also put some of the reported stolen items in the back of the squad car. And we don't know the name of that suspect just yet, but officers have been working the scene and actively and quickly were able to apprehend that suspect. We will keep following this story and let you know more as we get it. Happening right now, a man's dead after a shooting in Clarksville. Let's head straight to Cuthbert Langley. He's been live for us this morning at Vanderbilt Medical Center. So Cuthbert, you just got an update from officers a short time ago. You now have the name of this victim.
That's right, Amy. 30-year-old Joshua Simpson of Clarksville has been identified as the man who was shot and killed overnight. The shooting happened around 10:30, but he was transported here to Vanderbilt Medical Center, where he died early this morning. Right now, Clarksville police have not released any information about who a suspect may be at this point. But here's what we do know. The shooting happened around 10:30 at an apartment complex on the 100 block of Jack Miller Boulevard. Clarksville police are telling me this morning that somebody called 911 after hearing gunshots ring out through that apartment complex. And when they got on scene, they found Simpson on the ground with a single gunshot wound. They rushed him here to the hospital, but it was just too late. He died early this morning. And there was also another victim who also had some injuries, but it appears his injuries came from him running away from the shooter. He was taken to an area hospital there in Clarksville, where he is expected to be fine. But at this point this morning, we still do not have any information about what may have led up to this shooting, and also who they're looking for. Clarksville police aren't even narrowing down if it's one person or more than one person they're looking for. But if you do know anything about this shooting, of course, they're looking for any and all information at this point. Their tips line is 645-TIPS. Reporting live at Vanderbilt Medical Center this morning, I'm Cuthbert Langley, News Channel 5 HD.
All right, Cuthbert, thank you for that. And in other news this morning, a local hospital company, HCA, says they are preparing for the Ebola outbreak just in case. Of course, this after the big news yesterday of the Ebola case, the first in the U.S. in Dallas over the last couple of days. The chief medical officer of HCA says they are preparing their employees at more than 164 hospitals should the outbreak spread. They've also donated $1 million to help fight the outbreak. And new developments in the enterovirus outbreak. Concerns over the deadly strain known as D68 are growing after several deaths have been connected to the illness. 10-year-old Emily Otrendo is the only confirmed death. She was from Rhode Island. The CDC says they found the presence of the virus in 3 other patients who recently died, but so far it's not clear if their deaths were caused by the virus. Dr. William Schaffner with Vanderbilt University is one of the world's leading epidemiologists, and he says children who come down with the virus will react as if it were a bad cold, but can have serious consequences.
A few of them are getting more seriously ill. They have difficulty breathing, and it can precipitate some asthma attacks. If any of that happens, immediately get medical care.
An update to the story we first brought you yesterday morning. The enterovirus case out of Henry County is not the dangerous D68 strain. There have been no confirmed cases of the deadly strain so far in Tennessee. And officials at the Texas hospital are admitting that they didn't handle that first case. Now we're back to Ebola. They didn't handle that first case properly. A man unknowingly brought that deadly virus here from West Africa. Omar Villafranca has more from Dallas, where the hospital may have put people at risk of being exposed, even some school children.
Some parents in Dallas say they won't send their kids to school today after hearing 5 students in the area are being monitored at home for signs of the Ebola virus. Health officials believe they're among 12 to 18 people who may have had contact with the first patient diagnosed with the disease in the U.S.
The students didn't have any symptoms, and so the odds of them passing on any sort of virus is very low.
Health officials are also monitoring the Ivy apartment complex. Paramedics transported the patient from an apartment there. He's been identified by CBS Dallas station KTVT as Thomas Eric Duncan.
It concerns us what's going on so the kids won't get sick and everybody.
Federal health officials are now trying to figure out why the medical staff here at Texas Health initially released the infected patient when he first felt ill. Duncan originally went to the hospital on September 26, complaining of fever and abdominal pains, a week after flying in from Liberia. A nurse reading from an Ebola checklist asked if he had traveled from Africa. He answered yes, but was released anyway.
It's a key hallmark of a triage process is where have you been along with having these symptoms and how long have they been developing for.
Duncan was admitted to Texas Health 2 days later where he remains in isolation. Omar Villafranca, CBS News, Dallas.
And CDC experts say they are confident they have the resources needed to contain this Ebola case. They say it won't turn into an outbreak like the one in Africa. Meantime, another patient has surfaced with possible Ebola symptoms in Hawaii and is undergoing testing right now. We're waiting word this morning on whether the remains found in Cumberland County are those of a missing woman. 47-year-old Nina Owens was last seen August 10th and reported missing nearly 2 weeks later. Sheriff's deputies found a skull in a large wooded area off Pew Cemetery Road after a 2-day search. An autopsy is planned to determine the cause of Owens' death and if it will be investigated as a homicide. A gunman is on the loose after parents get involved in a fight between kids. Now one parent is recovering from a gunshot wound and another's on the run. The shooting happened around 6:30 at DuPont Avenue Apartments at the victim's home. Police say it was after their kids got into a fight. The victim is recovering at Skyline Medical Center with serious injuries. Police have not released any names yet. A meth bust in Clarksville to tell you about this morning. Police found the lab on Old Ashland City Road while investigating a stolen car complaint. They spotted evidence of a lab while searching the area and traced it to an apartment, a basement in that apartment. A hazmat team with the drug task force had to be called out and 3 people were evacuated from the home. Police arrested 25-year-old Molly Hickman. She is in jail this morning on a $10,000 bond. A Virginia man is in the Metro jail this morning after being found with 15 pounds of pot. Officers discovered the bundle in the back of a rental van during a traffic stop on I-40. The marijuana was wrapped with peanut butter, Vaseline, and plastic. Those items are often used to throw off drug dogs. Ivan Squire was arrested. He told police he was taking the pot from Texas to sell it in Virginia.